very quickly, let me tell you the treatment of staph infection. Penicillin is the most effective. Now, if those bacteria have beta-lactamase enzyme which can break this penicillin, then you will have to use cloxaxins or methicillin. Okay. Now, if the bacteria becomes resistant to methicillin, then you will have to give vancomycin. If it becomes resistant to vancomycin also, very sad situation, you will have to give linezolid. Fine. Now, that is why when you should never give antibiotic without checking the susceptibility. Don't give antibiotics if you misuse and you give so many types of antibiotics, the person will get or the bacteria will become resistant. Okay. So, you should always do a susceptibility test before giving an antibiotic. Now, how will you detect that it is resistant to methicillin? You will use something called as cefoxitin disc. Let me write that here for you. Just see here, I have written the name already, cefoxitin disc. To detect MRSA, you will use cefoxitin disc. And by that, you will mostly find out most strains which are resistant to MRSA. Okay. If they are resistant, you will give what? Vancomycin. Okay. Now, what about carriers? Carriers have different treatment. For carriers, you will use bacitracin. Okay. And if they are resistant to that, you will give rifampicin. Now, carriers or anybody, let us say, you should always use antiseptics like chlorhexidine, etc. to, wipe the hand, etc. to make sure before you touch somebody or they touch you, you should make sure that there is usage of antiseptic hand, what are those called as hand sanitizers, etc. Okay, these are very important. You should treat the carriers, you should detect carriers, you should treat them, you should sterilize instrument, hand sanitization is important. You should not abuse antibiotics. You should do antibiotic susceptibility by this disc diffusion method, and then only you should decide the antibiotic. Then only you should treat the people who have staphylococcal infection.